Good morning, it's Jennifer Shepard, your Integrative Manual Physical Therapist. And do I have a tear? Do you have a tear? And this is often the path when somebody is experiencing joint pain. Shoulder pain, hip pain, those are kind of the main ones. Sometimes knee pain, other pain elsewhere, but especially in the shoulders and the hips. Do I have a tear? And if you go to your doctor, your PCP will probably give you some NSAIDs, which I talk about that. Those are not good for you. They're not addressing the mechanics that are involved with whatever is going on mechanically, which is contributing to your pain. And then if you aren't getting your pain resolved, then you're going to get sent to an orthopedist. And orthopedists are very good at what they do. At the same time, their view of the body is very limited and very tends to be a bit more narrow focused into just a joint itself. And then their curiosities is, again, still what is driving the pain. So we appreciate that. They're not going to throw pain meds at you. But all right, let's dive deeper. And then very quickly, we jump into some tests. Maybe, oh, you might have a tear. Or they might jump into scans, right? X-rays, MRIs, which might show you have a tear. And often that happens. But what we have to talk about is what caused that tear in the first place. And do we really know if that tear, in fact, is truly causing your pain? It may not. But it's not as simple as, hey, we found a tear, let's fix it. Because we're still missing what drove the tear in the first place. So as we work with pain, I'm just going to stick with shoulders and hips, because that's where we tend to see more tears in the rotator cuff muscles. We see tears in the labrum. Same thing with the hip. We see tears in the labrum of the hip. And what we have to talk about is what drove it. So when you look at how are your mechanics in the hips and the shoulders, it's a ball in the socket. In many, many people, those balls are not in the right position, place. They tend to be more forward. So here you have a ball, whether it's your hip or shoulder, it should sit and spin. Most of us in the shoulder, we are tight in our upper bodies, therefore those shoulders come forward. So say we're playing tennis, or we're throwing a baseball, or doing anything overhead, and we are asking that ball's not just sitting and spinning, but it's sliding and translating. So here's all these beautiful rotator cuff tendons that are attached to your ball, and they are getting strained. And if you're even more unlucky and there's more restriction up at the acromioclavicular joint, you're getting jammed into that joint. So here these poor tendons are getting worn and literally torn with every movement, depending on what direction things are stuck and not moving well. But with every movement you make, you're getting a little bit of wear and tear until the point where here this little tendon is frayed and has nothing left. So jumping into why you have a tear, you have a tear. Even if it is something like, hey, it's to the point of surgery, we still have to address what drove those mechanics in the first place. And same thing with the hip. They tend to be in a forward position because of lack of movement at the pelvis. Everybody walks, everybody runs. Again, if we're lucky, right? Most of us have that gift and ability to do that. But if so, if one area of the body doesn't move well, you get too much motion somewhere else. So very often, people who even have tears in their shoulders and hips can live a healthy, painful, surgery-free life if you take that strain off those tissues, you decrease your inflammation, and you really, really, really take good care of that joint as far as the alignment and the deep stability and the overall efficiency of your body. And that's what I want to share with you today. There was one more piece. I'm trying to figure out what it was with regard to shoulders and hips and wear and tear. Oh, the last thing is there's so many studies out there that actually have to do with lumbar spine MRIs. And the point I still want to reinforce is just because these studies show that there are people, even young people, I think they were maybe 20s and 30s, who have documented disc bulges and disc herniations. I think herniations, I need to double check the research, but they're pain-free. So that point being, just because something shows up on an x-ray or an MRI, that doesn't mean that that is exactly the thing that is causing your pain. So it is not the best course of action to just go fix that thing that is broken, because that may not be the thing that is the problem in the first place. And that's why we tend to see so many failed surgeries, because surgery is just going in there to fix this thing that is broken. that maybe wasn't causing the pain in the first place, but it's not addressing the mechanics, the inefficiencies through the system, the inflammation that drives the degeneration, the wear and tear, resulting in pain and further degeneration.